Hello everyone. Welcome to another episode of Dental Digest with the Study Booths. I'm Dr. Trehan and today we'll continue our journey through oral pathology focusing on a fascinating cyst, gingival cyst. Now just like before, we'll break down the key exam relevant details and clear up what you need to know for INBDE, AFK or ADAT. So here is a sequence for today's video. We'll talk about origin and etiology, followed by pathogenesis, clinical features, radiographical appearance, histopathology, complications, treatment, differential diagnosis, and in the end we'll discuss the key points of the whole video. Let's begin by exploring where gingival cyst comes from. So in adults, gingival cysts arise from remnants of dental lamina, specifically rests of series, and tiny epithelial clusters left over during tooth development. Now in newborns, these cysts also stem from the dental lamina formed due to epithelial cells trapped during development. And remember, gingival cysts are soft tissue counterparts of lateral periodontal cyst, which is found in bone. Now let's talk about the pathogenesis, how exactly these cysts actually form. Now the epithelial rests of seres remain under the soft tissue periodontium, and under certain stimuli, possibly mild irritation or pressure, they begin to multiply. And this cell proliferation creates a fluid-filled space, the gingival cyst. And unlike inflammatory cysts, the development here is entirely benign. That is, it is not caused by any infection. So the key point here is that gingival cysts are not really linked to any inflammatory process, and they tend to remain small and asymptomatic. Now let's talk about the clinical features, and specifically let's differentiate the gingival cysts of adults from gingival cysts of newborns. Now, gingival cysts of adults, they are firm, well-defined nodular swellings. They appear bluish in color, they have a transparent hue, and usually it is less than 1 centimeters. Most commonly, they are found in the mandibular, canine to premolar region, along with the attached gingiva or interdental papilla. It is painless, dome-shaped swelling that you have to really look for. And in the gingival cyst of newborns, it is very tiny, 2 to 3 millimeters in size. White or yellowish papules could be seen, and it is seen in multiples on the alveolar ridge, more on the maxilla than on the mandible. It is asymptomatic and self-resolving in weeks or months. Now let's discuss the radiographical appearance. Now in adults, it's not usually visible on any radiographs because it's soft tissue cyst, but it may cause radiolucency because of some pressure atrophy that happens on the underlying bone. In the newborns, it is not seen again on the radiographs because there is no bone involvement. Let's talk about the histopathology now. Adult cysts, they are lined by 1 to 3 layers thin non-keratinized squamous epithelium, often with glycogen-rich clear cells and plaque-like thickenings. This will not be tested in the exam, so don't worry about all this what you have been just told. In the newborn cyst, it is lined by parakeratinized squamous epithelium with keratin debris, giving it whitish appearance. Again, histopathology is not tested in examinations. Now let's talk about the complications. In adults, most of the times these complications are restricted to aesthetic problems. Because of enlargement, most of the times adults want it to be removed. In newborns, it is harmless and they resolve naturally, but it's very important for you to educate the patient and reassure them that it is going to resolve on its own. Now let's discuss the treatment options. Now in adults, surgical excision could be given if the patient is too concerned about the aesthetics. So it's very straightforward and low recurrence is there. Now in newborns, no treatment is required. You just have to observe and reassure the parents. Now let's talk about the differential diagnosis because it is very crucial for your boards and in clinical practice as well. In adults, you can compare it to lateral periodontal cyst, but bone gets involved in lateral periodontal cyst. Then think about peripheral ossifying fibroma, which is firm, nodular, gingival mass, and then think about peripheral giant cell granuloma, which is having reddish hue, multinucleated giant cells are there. And if you're talking about newborns, think of Epstein pearls, which is present in the midline palate, not on the alveolar ridges. Then think about Bourne's nodules, which is present on buccal and lingual hard palate from minor salivary glands. Then think about congenital epilis, which is granular cell lesion present on the alveolar ridge, and distinctive histology is present. Now, do think about this fact. All three, GCN, that is gingival cyst of newborns, Bourne's nodules, and Epstein pearls, they're all benign, keratin-filled, and self-limiting. This is important. Now let's talk about the key points from this video. Gingival cysts of adults or newborns, they are remnants of dental lamina. Now, gingival cyst of adults, it's asymptomatic, firm. You see bluish nodule, which is present mostly in the mandibular canine to premolar area, and excision could be done if it is symptomatic or aesthetic concerns are there. When we are talking about gingival cyst of newborns, they are tiny nodules present on maxillary and mandibular alveolar ridge, and they resolve on their own. Radiographically, you're not going to see much because there is no bone changes that are happening, but some pressure atrophy could be there if it is severe. Then next we discussed differential diagnosis, lateral periodontal cyst, Epstein pearls, Bond's nodules, congenital epilepsy, and all of that. Then for newborns, no treatment is required, only reassurance has to be given. Thank you for joining on this episode of Dental Digest. If you found this video helpful, don't forget to like, subscribe, and share with your study group. As always, drop your questions in the comments and let's keep growing together. Stay curious, stay motivated, and I'll see you in the next one.